My name is Dr. Maitreyi Raman, and I'm a gastroenterologist and physician nutrition specialist at the University of Calgary. Today, I'm going to talk to you about dietary updates and recommendations for the IBD patient receiving biologics. When you ask patients, 48% of patients felt that diet could initiate their IBD. 57% of patients felt that diet could trigger a flare of their IBD. 60% of patients reported worsening symptoms, particularly with certain foods. 2/3 of patients deprived themselves of their favorite food to prevent relapse. And 50% of patients did not receive any formal dietary advice at all. And these data came from a large prospective questionnaire from 400 consecutive IBD patients in the United Kingdom. Now, turning away from patient thoughts and looking at the global epidemiology of IBD, we see that between the years of 1859 and 1956, IBD particularly affected individuals living in industrialized countries, largely in the Western world. But in 1956, the first case of ulcerative colitis was reported in China. And ever since then, the burden of IBD has rapidly grown in countries that are newly industrialized. Dietary patterns and environmental influences also have changed globally and very rapidly over these years, again indicating potentially to the role of the environment and particularly that of diet in new onset cases of IBD. Now, looking at this from a study perspective, there have been a few very large prospective studies that have also highlighted relationships between diet and new onset IBD. In the first study published in Gastroenterology, a high impact journal back in 2013, over 170,000 female individuals were followed up over 26 years. In that study, dietary fiber was found to be strongly protective against development of new cases of Crohn's disease in particular. But interestingly, all sources of fiber were not considered equivalent. Fiber coming from fruit and from vegetables was found to be more protective against developing new cases of Crohn's disease. Interestingly, no dietary fiber signal for protection was identified in ulcerative colitis. Now, looking at other dietary components from that very large study, legumes and nuts, intake of these at the highest level compared to the lowest level was also found to be protective against Crohn's disease. Similarly, use of olive oil was found to be protective against new diagnoses of Crohn's disease. Now, from another part of the world, another large prospective cohort study that included over 80,000 individuals were followed over 20 years. In this study, they sought to identify whether a diet pattern that was more consistent with a Mediterranean diet compared to less consistent with a Mediterranean diet had any effect on developing new cases of IBD. They found that over these 20 years, those individuals that had a diet most consistent with a Mediterranean diet compared to one that was least consistent with a Mediterranean diet had the lowest risk of developing new cases of Crohn's disease. Interestingly, the same signal was not identified for ulcerative colitis. Now, very recently, there was quite a large observational cohort study that was conducted between 2003 and 2016 in over 21 countries around the world. This was truly a global study. And in this study, over 136 individuals participated by providing their dietary data for analysis. The goals of this study were to identify whether processed foods and or food additives might have a role in developing new onset IBD. During this period of time, 467 patients were found to have new onset inflammatory bowel disease. And the study investigators identified that consuming greater than or equal to 5 servings per day of processed food was associated with an 80% increased risk of developing IBD compared to no processed food intake at all. Now, specifically, intake of greater than or equal to 3 servings per day of soft drinks was associated with almost double the risk of new IBD development. Intake of added sugar and sweets greater than 100 grams per day was associated with 2.5 times the risk of developing new IBD. And intake of salty foods or snacks was associated with double the risk of developing new IBD. So these large studies that I've discussed with you that have been conducted over long periods of time suggest that diet is an important risk factor for developing new inflammatory bowel disease. Dietary patterns make a difference to developing many chronic diseases. Specifically regarding Crohn's disease and ulcerative colitis, the diet may impact the development of new disease through a few different ways. Now, the healthy diet or the prudent diet is one that is rich in phytochemicals coming from brightly colored, richly colored fruits and vegetables, specific fats arising from omega-3 fatty acids, particularly from fatty fish, high dietary fiber, particularly prebiotic fiber or soluble fiber. These types of foods and nutrients can enhance the mucus secretion at the level of the gut, providing a barrier or a protective layer to prevent bacteria from entering into the intestinal cells and stimulating an abnormal immune response. Now, in contrast, dietary patterns like the Western diet, which are rich in sugar, higher in food additives, just like emulsifiers or maltodextrins, higher in fat, particularly saturated fat. These types of dietary components can reduce that protective barrier effect at the gut and may make it easier for harmful bacteria to drive through the intestinal cells and stimulate an abnormal immune response. In addition to modulating the bacteria and maintaining the barrier at the level of the gut, diet may also influence how your genes express themselves, either increasing or reducing the risk for chronic diseases. And diet may also affect the immune cells directly and affect how they function. So there are several ways through which diet may, in fact, either contribute towards disease onset or have a role to play in how your disease evolves over time. The first high-quality randomized control study was published by Dr. Ari Levine in a group of children with Crohn's disease. This study largely came out of a group in Israel with a Canadian component. Now, the Crohn's disease exclusion diet is a whole food diet that is coupled with oral nutrient supplements designed to reduce exposure to dietary compounds, which are hypothesized to negatively affect the microbiome, the gut mucus layer, and the immune function of the intestine. We briefly reviewed some of these dietary components in the previous section of this talk. In this large randomized controlled trial, 40 children were assigned to receive either the Crohn's disease exclusion diet together with oral nutrient supplements or another gold standard therapy called exclusive enteral nutrition. This study was rolled out over a 12-week period. At the end of the 12 weeks, the study results identified that 76% of patients who received the Crohn's disease exclusion diet were in fact in remission after use of the diet plus the nutrient supplements alone in patients who received the Crohn's disease exclusion diet compared to those that did not. Now, also importantly, looking at the level of inflammation specifically in the gut through a biomarker called fecal calprotectin, there was a significant improvement in the burden of intestinal inflammation as measured by this important stool sample. Now, the authors concluded that the Crohn's disease exclusion diet, which uses a whole food diet delivered together with oral nutrient supplements, was effective to induce remission in children with mild to moderate Crohn's disease. Very recently, the same study has been evaluated in adult patients with Crohn's disease with very similar findings. Now, in 2021, another important study was published comparing two different types of diets in Crohn's disease. So the DINE-CD study, which stands for the Diet to Induce Remission in Crohn's Disease, was a randomized control trial comparing the effectiveness of the Mediterranean diet and the specific carbohydrate diet to resolve symptoms and inflammation in patients with Crohn's disease. This study was conducted in 33 sites across the United States. And adult patients who had mild to moderate symptoms were eligible to participate. In order to participate, however, stable medications and doses were required. For the first 6 weeks, participants received weekly delivered meals consistent with their assigned diet. After the next 6 weeks, participants were taught on how to prepare their diet. Now, as I indicated to you before, the Mediterranean diet was found to be protective against people developing new onset Crohn's disease. So for that reason, the Mediterranean diet was one dietary pattern that was of interest to this study. Now, the specific carbohydrate diet is another commonly used therapeutic diet for Crohn's disease, particularly in pediatric Crohn's disease. And it's characterized by certain allowed foods and excluded foods. At the end of these 12 weeks, both diets resulted in improved symptoms in close to 40% of patients. Other improvements included overall quality of life, fatigue, importantly, sleep quality. These three factors improved during the course of the diet, regardless of which diet was assigned. Now, looking at markers of objective inflammation, there were some improvement in inflammation, particularly in those that were assigned to the specific carbohydrate diet. At 6 weeks, those in the specific carbohydrate diet reported a decrease in fecal calprotectin that occurred 35% of the time. And 26% of the time, patients reported a decrease in fecal calprotectin at week 12. So overall, a quarter of patients had significant objective evidence of decreased inflammation at week 12. So the authors concluded that potentially there's a role for both diets in the management of their Crohn's disease, but perhaps the Mediterranean diet may be preferred due to its well-documented effects on overall health. However, as you can see here, although many patients had improved symptoms and quality of life, which are of course very important markers, the objective evidence for inflammation still only occurred in a smaller subset of patients. Now, I've talked to you today about the Mediterranean diet, the specific carbohydrate diet, and the Crohn's disease exclusion diet. These diets all have some similarities and many differences. So knowing how to implement these diets and understanding the content of these diets can be very challenging without appropriate resources and help. So to make things simple, we published on the first IBD food pyramid in a high impact journal called The Lancet Gastroenterology and Hepatology earlier this year. This food pyramid serves to prioritize specific foods and food behaviors in order to maintain overall health in an individual with IBD. And this food pyramid consists of 5 priority behaviors that have been either shown to reduce inflammation in humans or in animal models. So there are certain levels of data associated with each of these recommendations. And therefore, these food recommendations have been specifically chosen to inform the first IBD food pyramid to overall improve the course of disease. Now, the first 2 priority behaviors are rich intake of multicolored fruits and vegetables. Multicolored fruits and vegetables are not only rich in dietary fiber, particularly prebiotic fiber, but they're also rich in polyphenols, which are specific dietary compounds which have been shown to improve inflammation and improve the gut bacteria. The first rung of this food pyramid is also recommends rich intake of leafy greens between 1 to 2 servings per day. Leafy green intake has been associated with decreased intestinal inflammation in 2 food studies that we recently have completed. Priority 2 behaviors include rich intake of starchy foods, particularly foods that have starches that have been cooled or reheated. And again, starchy foods have been associated with an alteration of the gut bacteria in order to be friendly for the individual that has IBD. Priority 3 behaviors focus on choosing healthy meals, particularly homemade meals, and limiting processed foods, baked goods, and foods with food additives. As I've shown you, the large prospective study highlighted significant new disease together with higher intake of processed foods. And for that reason, particularly for reasons associated and seen in animal models about how processed foods may affect that mucus layer in the gut and reduce that important barrier, healthy meals, homemade meals without food additives are recommended. Priorities 4 and 5 surround choosing healthy proteins and choosing healthy fats. We recommend choosing white meat more often than red meat, focus on fatty fish, as well as nuts and seeds, together with that of healthy fats, with a recommendation for olive oil for reasons that previously have been discussed. So please review the IBD food pyramid to give you an idea about how to prioritize your food behaviors in a way that might be helpful to minimizing inflammation and improving your overall symptoms. So today we have reviewed the growing literature for diets and diet components and how they may be involved in IBD onset or affect the course of IBD. But choosing the right diet and implementing a diet plan that is right for you can be very challenging. There are lots of things to consider in this journey, including where do I start? What foods do I prioritize if I am in remission or experiencing a disease flare? How do I incorporate the ideal nutrients and food components into a meal? How do I remember the various foods and nutrients that are beneficial for my IBD? To help you with this, a novel mobile application called the LifeMD has been developed specifically for you. The LifeMD mobile application is an evidence-based diet and nutrition tool to help you become the healthiest, happiest individual that you possibly can be. When you use the LifeMD tool, you will be asked to complete validated food questionnaires. These food questionnaires will assess your current food intake patterns and your food preferences. Based on these 2 items, the LifeMD application will provide you with specific food goals, behaviors, and targets that are personalized for you. These goals and targets will take into consideration your dietary preferences, as well as the important factors that will help you take your dietary quality to the next level to help manage your gut inflammation. You will be able to track your dietary practices and your dietary behaviors over time to have a sense for how well you are performing with the diet. In addition, you will be able to track your symptoms and see how adhering to the dietary patterns recommended in the LifeMD app may correlate with improvement in your symptoms as well as your overall well-being. Now, apart from diet, patients frequently report having depression, anxiety, fatigue, poor sleep, not feeling rested in the morning, and lower quality of life. These symptoms may have a direct impact on personal and professional relationships. Patients may miss work or school days, spend less time in social activities with friends and family, see doctors more frequently, and present to emergency rooms and have hospital admissions more frequently than people who don't have these symptoms of depression, anxiety, fatigue, or lower quality of life. Again, the LifeMD mobile application could be exactly what you need to help take your symptoms and your well-being to the next level. The LifeMD mobile application, in addition to the dietary components and program that we have just discussed, also includes a program to help improve your sleep, stress, quality of life, overall well-being, and physical activity. Using validated questionnaires, the LifeMD application will characterize your sleep quality, your current levels of stress, and your mood, and provide specific recommendations around activities that you can engage in to improve all of these parameters. Using validated tools such as mindfulness, breathing exercises, and yoga, as well as a structured physical activity plan, you will be provided with options that you can engage in a way that is personalized for you. For example, if you only have 5 minutes in the morning to help to allocate towards specific well-being exercises, there is a 5-minute yoga and mindfulness program for you. However, if you have an hour at night before bed that you would like to dedicate towards your well-being, you have the option to choose from several programs to execute in a way that makes sense for you. These programs have been validated in clinical trials and have been shown to have specific benefit on improving quality of life, anxiety, depression, and other aspects of your well-being. So in conclusion, diet and lifestyle have an important role to play to enhance wellness and clinical outcomes when living with IBD. Importantly, diet and lifestyle can be modified to improve some clinical outcomes. This is an opportunity to empower you to take charge of your disease. And to help you on that journey, evidence-based digital tools are now available to help you execute this process. Thank you.